I'm really excited to be invited to be a guest at this very important meeting. I'm sure during the course of this discussion, I will share some of my experience. But let me just say one or two things before we start. What we are going to discuss today is something that Dr. Kene has introduced me to about 1 year ago. I'm sure he will forget. But it's almost 1 year now.
Oh my God.
Last week, one lady called me to tell me that my wallet has expired. I need to renew it. So quickly I have to go on the platform and renew it immediately. I said, this is almost 1 year. So it's really a very interesting thing. It's my hope that let's concentrate and listen to what he's going to say. It's something that is going to be not only beneficial to us as an individual, but going to be beneficial to the community. It's really taught me how to make some savings. Initially, I was very skeptical of joining this thing online. As usual, of anything online, you'll be very suspicious that whether it is genuine or not. But Dokene was able to really put me through. He came to Jalingo in my office. He showed me how it works. But reluctantly, I started with a meager amount of money. But before realizing now I have the maximum amount in that account. And I'm really reaping the benefit. And of course, that money, I could have used it for other things. And it's gone. But that money is still there, and I'm still getting something passively without doing anything every week. So thank you once again, Dr. Kene, for introducing me to this. It's my hope that other colleagues on this platform will also benefit from this thing that we are going to discuss. Thank you so much.
Okay. Okay, thank you, Dr. Garba. We appreciate those comments. So we can start. We simply want to provide information to our members. Okay, so thank you very much. The presentation is titled Telecom Innovations for Public Health Practice. It's a 6-month pilot of the ViGit system approved by the leadership of Association of Public Health Physicians for public health physicians in Nigeria. The project is titled Project 2480, and it's going to run for 6 months, starting from May to October. Then there will be an assessment in November, and then of course a report writing in December and presentation in January at the conference. Now, the essence of going this far is the fact that each time we have conferences, people will produce communique and action points that should be taken. Most times there are no follow-up actions until the next conference. For what we are designed, we felt that, look, there should be actionable activities that we can showcase to our members. So the essence of this weekly presentation is to simply provide awareness and education. It's going to run the whole of May. Each week we bring in a special guest who has experienced this for a long time, enough to make informed decisions or to make informed statements about what we've done. For me, most of you don't know me, but my name is Dr. Kene, and I'm a public health physician like any of you. But I had the privilege of, in my early life, having trained in computer science. While I was doing housemanship, I had someone who had a computer center, and in those days was an institute where I did a diploma in computer science. That has defined my public health practice. Along the line, while doing residency, in those days, the whole of the department was among the few people that knew how to use computer. And they were desktops. Then along the line, my uncle sent a laptop to me as a resident. Then I was a big boy having a laptop and a software. So I started using SPSS and other softwares. So essentially, when I now joined development work, people find that skill useful, and I was involved in content development of software. So I may not be a strong programmer in terms of programming languages, but as far as content development software is something I know very well. And if you know, in NGOs, once you have such skills, they're being maximized. For this reason that I went into what we're doing today, And I look at it very well and saw that it's something that can benefit us, and I committed my time to it. Essentially over 18 months. And these 18 months have been 18 months of learning, putting efforts into it and things like that. So the project and the principal investigator. So what has happened? First is the background of what has happened around us. All of us were part of COVID. And during COVID, everybody was scared. Most of us who had businesses lost a lot of income because of logistic issues. They were locked down. But one business that was booming and has completely boomed is the telecom industry. Now, yesterday I was talking to somebody. I said, "Why do you work?" They say, "He has passion." I said, "No, if you have passion, you work because you want to be paid. Just work for 3 months and nobody pays you, and you realize that the passion will die." So the whole idea is for funds to circulate within public domain continuously. If funds are circulating within our domain, we will not have issues with the project we are talking about. You go everywhere, we talk about projects. Once the project dies, talk about sustainability, all manner of say around sustainability. But once the project ends, that is the end of the project. If the cycle for funding ends, everything goes down. So for me, this is a vision. And we're trying to see that we have this done. So you know that the telecom industry is circulating a lot of money, and documents have shown how much this has contributed to our GDP, and the fact that this have also contributed to our getting out of recession. And we also know that, look, the industry is not going down because there are newer ways and techniques that are making the industry very useful. Now the domain that is making money is actually use of data through Zoom. So as before we finish this Zoom call, most of us, our data would have been consumed. And the question you ask is, where does this data go to? But remember that the data consumed will become money for somebody else. So if you're on that value chain, that money becomes your source of income. But most of us as doctors, we can't be on the value chain of the telecom industry because we're trained to be doctors. So the essence of this exercise is to bring us to the value chain of the telecom industry. Look at what MTN made just last year, 1.7 trillion. Which hospital in Nigeria will ever make that type of revenue? Which hospital? Put the whole 10 hospitals together, they will not make that revenue. So we cannot go to that. By default, it's an industry we cannot play in by default, but there are opportunities for us to play in. Now the role we are playing now is each of them that are consuming our resources, but we cannot find ways by which these resources can actually come back. So the banks consume our money. Now, by the way, most of the banks are now converting to other companies. You hear about GTCO, it's now a holding company. So the bank is just a pool of places where they do other businesses. They have marketing places. But a doctor cannot go and set up an online marketplace and then people will clap for you. It's not possible. The Asian companies consume a lot of money. Zoom is taking our money. Social media consume both time and money. So the time you should be doing something else, you're committed to that. Of course, telecom takes a lot of our resources. So for us who are working outside this industry, we are simply users of the system, and expenditures of our money goes to the system. So there's no way the money is coming back to us. There's no way money is circulating into our cycle. So it's difficult. It's difficult in this global economy for you to have one source of income, but that income is always leaking to other systems. And you want to make enemies. So it's the lack of role that we saw in the health sector playing in this industry. So is it possible that there could be an innovative financing mechanism? Because we attended several meetings. Now remember that as part of our training as public health physician, we talk about healthcare financing, right? Yes, most times we talk about healthcare financing, and there's a core course of who specialize in healthcare financing. Now, healthcare financing models keep changing on a daily basis. People are saying that, okay, can we use the USSD code and tax USSD so that at least if it's 1% of the money from the telecom industry comes to the USSD code that's linked to the banks, that money can now come to us. But remember, that money will go to central banks. Remember, that money will go to the accounting system of this country. The moment you start the process of moving that money to a health industry, believe me, what will reach the health industry will not be anything significant for us to talk about again. So if we have our way of saying that, look, can the USSD code be linked to health practitioners in such a way that they can make 1% income. That would be something that, yes, we work with because it's not passing through any other person. So we've been talking about how can this telecom digital cash flow circulate among public practitioners to enhance quality of work. So it's for this reason that Ave Health Sense, in partnership with ViGit Platform International, has come up with systems that will circulate value and create a source of income while taking care of your expenses, whether personal expenses or office expenses. This is what has brought the two enterprise companies together. So what are the three components of the ViGit system? The first one is digital, the designing of digital tool for real-time data capturing of key performance indicators and for feed-based monitoring. Now, you in life, you keep developing your skills in something on a daily basis. We know how very well that within our office, we can design this to real time. But today I was in the office doing designs, and we just discovered new formula that we never thought about. We discovered that we can upload and replace previous tools that we have created, and nothing will happen to the original form, and things will run seamlessly. This is what development is all about. This is what self-development is about. This is what to do is all about. So these tools can be deployed across the country that reduce cost of operation. That is the truth. And the capacity is within house. So that's the first component that we do. In fact, the data we are working on is a data from South Africa that we're working for a particular organization. So you can imagine that we're here in Nigeria designing things for people outside the country. And of course, if they're paying us, they will not pay us in the local currency. They will pay us in currency that we can convert to something more useful to us. Now, the second component is the virtual top-up automated tele-trading system that offers 1% weekly commission for cost recovery. This is the idea around cost recovery, that if 1% of funds circulate among public care physicians, projects can end, but the funds available for the project or recover from the project can give us a cost recovery system. We can build these systems for institutions so that funds keep circulating and they are not under pressure. In fact, for most of the people who we have worked with, we simply tell you we want your office to run at zero overhead cost. And we can build this in such a way that really happens. And we've been doing this for 18 months. The third thing, the third component of this is advanced combo back basic for mini audio telehealth. Now, these systems connect individuals, connect groups together. For instance, if in your practice, you are able to connect all the primary care centers and you are able to connect the head of the PACs, the MIE, and the other focal persons on a network, so that this network now connects to you and you have a dashboard in your office. What simply means that each time they want to communicate with you, they do that 24/7 at no cost to them. At no cost to them. And that will enhance our work because I don't need to be in any hard to reach area to get information. The person is there. I used this system in 2010 while I was working in JOS as a medical, as a director of community director interventions. But of course, I didn't know much about it at that time, but now it's something I know very well. And then we're one of the enterprise registered organizations. Joshua, who is an anchor on the telecom component, is naturally supposed to be with us, but he has a very busy schedule that he couldn't join us today. So Dan will take the session of so Dan, over to you.
Okay, good evening. My name is Odia Daniel. I'll be taking this session about ViGit Platform International, the association, the company who's partnering with Ave Health Sense. And I'll just go straight to the point. On our slide, as we can see, we have the registration information of ViGit Platform International, who is providing the service of My Wallet Shop, which is the component that has been incorporated into the ViGit system, which is used to earn the commissions, which was just introduced earlier. So my ViGit Platform International is a registered company with in Nigeria. We have their licenses, as we can see on our slides, but I won't want to waste much of our time with this, but these are all our licensing information for ViGit Platform International, as well as the address information. So My Wallet Shop is one of the components which has been incorporated into the ViGit system. And what my wallet shop simply does is it gives you 1% commission on your trading amount, which you have in your shop wallet activated. And it gives you 2% commission on every airtime, data, or cable TV subscription which has been purchased. So this system in such a way is used for your cost recovery. So all you just have to do is calculate what you spend on airtime, data, your cable TV subscription in a year. You put all this information together, the total amount together, you can own a shop. And when you own this shop, it is being traded automatically, and every 7 days, you're getting your weekly commission of 1%. The values of the shop will be introduced to us later on the call. And then ViGit, the ViGit system is using the My Wallet shop to run the audio telehealth seamlessly, in the sense that you get to make your calls at no cost to you. When running a project, you can make your calls seamlessly. You can communicate within everyone on the team. This is used to save cost for public health practitioners. So with My Wallet shop, you get instant commission on every data and airtime recharge, which will be, we'll see the demo later on the call, which is the 1% commission I just mentioned. Other services are there on My Wallet shop, which we would also see. We can buy airtime and we can buy our data as well. And every time you buy your airtime and your data, you get a 2% commission on every purchase you made. Electricity bills can also be paid as well from your commissions, which you earn from your trading shop, which you get every week. If we move on to that, this is also a breakdown of the commissions I just explained earlier. 2% commission on every airtime and purchase, airtime and data purchase, 30 Naira commission on TV subscription, and 1% commission from your shop trading to give you your commission every week. The combo pack basic is a service which is being provided by Nine Mobile, the third party, which has given the third party license to Virgin Platform International, to enable them have a connection for everyone who is working on the team on the project. This will enable everybody to be able to communicate with each other on the project seamlessly. For example, visiting a facility in a hard to reach area, you might not be able to go there, but if the combo pack basic is being activated, you can be able to contact that facility at no cost to you, as long as you have your trading shop activated. Now, this will enable everyone working on a project to communicate easily. And the recharge is just 1,000 Naira per month. Once you recharge 1,000 Naira per month, you can use the 1,000 Naira to communicate with anybody on any line. But once you're communicating with everybody who has been linked on the combo pack basic service for that project, you're communicating for free. The digital system has been incorporated and has been integrated with Flutterwaves. All the banks have been integrated as well to make all transactions easy. As long as there's no network glitch, all transactions go easily. And as long as there's no network glitch, all the 4 major telecom networks will also have their airtime and their data purchase dropped and transferred to your line, which you're recharging, in less than 5 seconds. Okay, so that's just a short breakdown of Virgin Platform International and the services they offer. I think Dr. Kenneth would take over from here to give us more information on the project process. Thank you very much.
All right, thank you, Dan, for that wonderful flow. So the project implementation, so how does it work? First, before I go to that, these are issues that we intend funds circulating among us can address. There's increasing costs with the same salary. Salary has not changed, but the costs keep increasing. And of course, if you don't risk people's calls or call them, they feel something else. Little hazard allowance, there's been a lot of talks around here. There's inadequate funds for our intervention, so there's need for us to do cost-saving measures, which is part of our practice. There's need for monitoring evaluation, and of course, need for supportive supervision for hard-to-reach areas. And increasingly, we're having issues around security, which even those places we used to visit have become difficult to visit on account of security issues. But of course, how can we get data from such locations and use for our work? There is no Zoom or communication allowance. Nobody does that. But there's almost no day that goes without having a Zoom call. So this presentation is on account of this project is on account of the communique issued at the last conference, where the federal and state ministry of health, as well as divisions and legal agencies, were encouraged to adopt the direction of public intervention. So we felt that to improve efficiency, we felt that we shouldn't just leave this to people else. We should test run this, and then we can now suggest to people to do. So what is the project assumption? The project is saying that increasing the circulation of telecom funds among public physicians will improve and enhance the quality of their work, which means if there's technical know-how and skills without finance, there's frustration within the system. So what are we doing? We're trying to see how we can now increase finance to that equation, we add finance to that equation. So if we increase the circulation of telecom funds among public physicians, there will be improvement and enhancement of the quality of work. Now, what is the strategic plan for the project? One, the plan is to have 4 weeks of Zoom meetings for training and education on Wednesday and Sundays, 8 p.m. for the first 4 weeks, which is actually May. So this is our 3rd week of these Zoom meetings. We have last week, next week, and then we're planning to have another one on Sunday. The second plan is to activate at least 5 members per state of Association of Public Health Physicians. And of course, they are affiliates. So if there are doctors who are interested, the whole idea is to test run what we have built for 18 months. So if there are doctors and the affiliates who are able to do it, that's fine. The third strategy is to conduct digital tool training for interested states. So if there's a state that want to train their staff on digital tools, we are willing to do that either virtually or physically. If that matters, then we also deploy the mini audio telehealth for selected institutions. So if this institution say, okay, fine, all our primary care facilities, we're going to have an audio telehealth for them, we should be able to do that. Then deploy the complete ViGit system in selected states, which we're in discussion with some states who are already interested. So the cycle runs like this. So the whole of May, we're going to be conducting this Zoom. So if I hear today Wednesday, you can come back again on Sunday, it doesn't matter, we will be here. We're like newscasters. So once we have a schedule for the broadcast, we surface. We're also going to work with individuals and groups to see that states sign up 5 members per state from May to July 2023. So after this training, we can have one-on-one webinars with various states, so you can have your state group, and then let us know we have a schedule either in the daytime or anytime that's convenient for you, so that we can share this information one-on-one. People don't have this knowledge, so our job is to make sure that knowledge is out there. Then we also design digital tools from May to October, deploy from May to October, and of course, continuously deploy the ViGit system for selected states. Then by November, we will now do the evaluation of the project, which means we have a questionnaire that we send to all our members and those who are participating in the project, either by way of training or by way of really experience the system and give us what they feel. They will now do a report in December and do a presentation at the next conference happening in River State. So this process is done in such a way every month we're reporting to a national leadership so that they understand what we're doing. It's like any other project you have implemented, though it is not following all your scientific tools of statistical principles. So what is the application of my ViGit shop in project management? How does it apply in project management? Now, this is what happens naturally. Your power supply bills will pile up. Communication bills must happen in the project. There must be fuel, office maintenance, pay Zoom. These are necessary project expenditure. Now, at the end of 12 months, this money will never return back to you or your system. At the end of 12 months, this money will never return back to you on your system. Now, remember the guest speaker was just telling us that he has clocked 12 months of using this system. It was on one of my project visits in Taraba that we were talking and told me, well, this is what I'm working on. And being someone who have known me for years, he didn't hesitate. He said, by the time I said, look, go ahead and try it. The following week, he called me that, why is it I didn't tell him on time that I'm taking so much more before telling me? I said, at that point, we're building, and we're not very sure of how the system will finally look out and what shape it will take. But at the point I was talking to you 12 months ago, I was very confident at that time that the system is working. So if I was that confident 12 months ago, today there is 12 months, meaning we have worked on this. And he has his own experiences to share, which we'll do that later. So the truth of the matter is that this money goes. So this money goes and it will never come back. So what we are saying is that estimate this money and then calculate all this and ask yourself, wow, so in 6 months, if I'm going to spend 50,000 every month, in 1 year, I'm going to spend what? 12 months times 50, or 6 months times 50. Now, what it means is that if it's 12 months times 50, you are talking about 600,000. That money will never come back. Now, if you have a system that can now use your resources, trade airtime, and then give you the commission that you can use to solve that project, that's what we're simply saying. That don't keep that money somewhere. Estimate all the monthly needs and sum it up. Get a shop that is trading. I do offer you the same opportunity to buy airtime, to do Zoom. You are not working on and thinking that I don't have money for that data. I have not thought about data as an issue. Data for the last 18 months has not been an issue for me, for our office, for my family members. In fact, there are some people that I have consistently been loading airtime in their phone without telling them. And the reason is simple. They see at the end of the beginning of the month, I send them as bonuses. Till today, they don't know who does that. So because this system trade and offer you that, so you are practically operating at zero overhead cost. And at the end of 12 months, your funds are available to you. I'm sure our guest speaker today, special guest, will talk to us on his experience later. You're operating at zero overhead cost. So technology, I keep emphasizing, technology does not reverse itself. There was a time we didn't even know how to use computer. Some people have to go for training for computer. Others were saying, what are you talking about? I don't need the training. Those who say that time they don't need the training came back begging that they should be trained. Because where are the tapists? Where are the tapists? No office now has a tapist. Nobody. So if you come to your office and you say, oh, who will tap this letter for me? You're on your own. And we can't go back to that period. Now, as I talk to you, where we are today, we can't go back. Where are the telephone lines? In those of you who have a telephone line, you beg. We can't go back to that. So these systems are coming, and they are coming in different forms, taking away our resources. People who bought those telephones at a point, they throw them away. They threw them away. But today we have technology that's helping us. So the ViGit system actually is a real-time data capturing tool that helps us. It combines the component I've just talked about before. It offers a solution for states in order to move away from paper-based forms to digital tools to monitor medical services real-time. It provides effective, close monitoring and supportive supervision for selected health facilities and provide a system where people communicate unlimited. And building that, it is automated that there is a huge cost recovery component of it. You don't need to think about when the project will end. So how does it work? It gives you a soft copy tool that helps with monitoring, and there's what we call field-based monitoring. This is what is happening these days. If you are going to work in a place where there's there's security risk, you know there's a PSC there, you can't go, because the challenge of it is not the people who are that PSC, is in between travel time. As we're living from one point to another, crisis may arise, and then you find yourself in the middle of issues. So if you have someone who lives in those locations, what you simply do is configure an Android device with all your key performance indicators, all your tools will be on the device. Once the tools are available there, will help you design this and host them. real time. And then they are with the device. Then at your own end, there's a dashboard. You can make this dashboard on your handset or in the office or in any location of interest. They will now build an automated system where you don't need to tell these people to give them airtime. No. Once the system is automated with Common Park Basic, this system here automatically load their phone. Now, for any CUG you use, most times the problem is when the funding for the CUG is gone. Closed user group. For your funding for closed user is gone. So if there's a project giving you money for closed user, once the project ends, that is the end. In this system, we build a closed user group, and then we build an automation that found it, because every closed user will require that 1,000 naira should be loaded in all the phones. So which means if you have 100 people and they're using closed user, you must be paying 100,000 every month. Now, in the model we have designed, the system simply trade and fund that 100,000. At the end of the year, you have no issues around whether the project have ended, because the system will continue to fund and trade. I mean, to trade and fund the system. So the guy who gave you the initial idea of setting up a city to monitor your project, now the funds have gone. You being the wise public health physician have set up a system, and the system keep working for you. As far as you are concerned, it's the excitement that comes with getting results, whether there's money or no money. So this is what we're doing. This is what we have done. This is what we have built. And this is what we're saying, my colleagues, come over here and see. We're not telling anybody on that competition to do anything. No. Just come see, study with us, ask us the questions, just run it, and give us feedback. All the software you are seeing here, from WhatsApp to Facebook, they didn't start from day one and became what they are, because people were using it and providing feedback. And this feedback are now being used for enhancing the products, and we're making use of them. WhatsApp just had its own upgrade 2 weeks ago and things like that. So the benefit of this system are here. It gives you access to clear and accurate data. I provide unlimited connectivity with communication. Of course, gives you easy flow of automated systems. And of course, it's low cost of operation. This is what we're looking at. These are the versatility I will need to work. So what are the risks to this project? I'm sure that's why most of us will be asking that, oh yeah, we've said about this. Yes, the first risk is changing government policy on the use of virtual top-up, because the trading system is essential around use of virtual top-up, what we call VTU. But of course, we said technology cannot go back. So a few months ago or years ago, people were selling recharge cards, paper-based recharge cards. But those things have been justified to have high cost of operations, and of course, they are not biodegradable. So we can't go back to that technology. So it's difficult for government to walk up to that and say, okay, fine, they're not going to do VTU. And of course, if they are doing that, the people who will fight them more is the banks, because the banks now are using VTU to sell airtime to you on a daily basis. And by the way, each time you buy airtime, they make a commission. I imagine commission of 2% of 1,000 every day, 20 naira times the number of people who buy airtime in a day. That is huge funds. But those funds don't come into public health. They don't come into the health system. They still circulate within the banking and the telecom industry. Now, the second risk that we will encounter is alteration of the telecom value chain incentives for VTU. This is what happens. Now, the VTU system has a value chain based on profitability or volume of transaction. During COVID, most of the telecom industries have huge incentive because they made a lot of money and stuff like that. Now that COVID is over, of course, the factors that keep people at home are no longer there. So people are moving and having their interaction. So it could be that, okay, they have incentive issues, then they can reduce the incentive, which may happen from time to time. Now, there's a telecom policy change on the use of closed user group. Yes. So it's not every company that will say, okay, I want to do closed user group. And the reason is simple. Most of them are making more money now from data than calls. So why would they invest money in calls when the money is coming from use of data? Because there are more people on WhatsApp, they call it everybody on WhatsApp. When there is instead of anything that people are posting on WhatsApp every minute, they are happy. They are happy. So when these issues in the South, people are posting, oh, now there is a political year. Oh man, they are making a lot of money from data. So they may choose not to be involved in a closer group. But that one too has its own benefit during this year of electioneering. There also limitation of network coverage by telecom, by the telecom. Yes, it's not all the locations that will have particular coverage. So when we are deploying for the telehealth specifically, we do research on the quality of data, quality of network connection in that location before we deploy. So if we go to a place where the better option is 9mobile, then we will now get 9mobile SIM cards and deploy them there. Now, another issue that we may encounter is the rising cost of Android phones on account of dollar exchange. So all the Android phone and dashboard accessories, the price keep rising because dollar now is something else. So before people import these items to the country, the price of dollar goes higher, and then the cost of this also go high. So these are the risks that are associated with this. So what are the strategic resources that can help us? People ask you. Now, we are talking about financing mechanism. So if I talk about financing mechanism, we also look at where would the resources come from. The first one is philanthropy to support the digitalization project. You may get someone who says, okay, fine, please, I want to support you to digitalize your process. Or you write a proposal to somebody who looked at it and said, okay, what does it cost? Oh, it will cost you 5 million, 10 million, or whatever amount of money you want. I say, okay, fine, implement that project, and then you start to digitalize. Now, for those of us who are being supported to do some medical outreach, this is the time you should be thinking beyond those outreach. How can you digitalize the process and keep having those people you work with within your fold? We can also fund this from budgetary allocation from state budget. We can also have international donors support this activity. We can have donation of device from manufacturers or distributors. And of course, some states have health insurance scheme where they can build this into. Now, what are the action plan? Action plan is for each state to have 5 public health physicians subscribe to be early adapters who will now help with the whole process. The PSC board to use this as audio telehealth to monitoring system, which will scale up the model through cycle of influence or what some people call respondent-driven sampling. And some people are already part of this and we share some of their experiences. And I want to say again that technology will never resign itself and we must be positioned to take possession of available opportunities. So this is a cycle of influence model. So each state have 5 people. Then of course you have the optional, you can opt in to get someone else, which is what some of our colleagues have done. But then this will be a focus to see the system spread. So the law of artificial innovation theory helps here. So we are the innovators as far as ViGit system is concerned. So we're expecting just 13.5% to be early adapters. So we're not expecting every public health physician in Nigeria to jump at this. So we know how this works and we've used this model. So we want that gradual process where it will be institutionalized and then we find ourselves contributing in this way to our association. So the code for the project is 102480. So there's a link here for those who want to sign up immediately. This link will be in the chat box. And then, of course, help us post your name, your email, your telephone number, and the state you are coming, you are joining us from, so that we are from, so we can keep our records. Of course, if you do, you can sign up now. Now, what is the update? Project updates. I say we are providing the project frequently. So as we started the project, Plateau State have 2 people activated, 1 sign up. Edo State have 1, Rivers have 2, Kaduna has 1, Bayelsa 1. We're in discussion with Adamawa State to have a ViGit system. We're also having discussion with Yobe. There's a discussion around this with Benue State, which I just started some few days ago. So that is yet to be updated here. On that note, I want to thank you very much. Once social enterprise have a diverse and stable set of income streams, they are better placed to have greater social impact. So whatever we are doing here, if your streams of income, no matter how small, 1, the burden of airtime have been taken away from you, man, you do better. One, if you can send that CHO that have helped you with data collection, 500 naira airtime, you will see the person hugely motivated. I have used this system hugely in the light team to motivate people who work with me. Behind the scene, you have our research support officer, Stephanie, who is always available to provide support both on WhatsApp, on phone, and of course during this course. Then our IT expert just spoke with us on behalf of White Joseph was not around. So he's always there to support. He does infographics. So even if you want him to help you design that, he designed our website, design other stuff. And he's someone who is very versatile as far as technology is concerned. So it's available. He's behind the tools that we design, behind the system that we design, behind our infographic designs. And essentially, he also designed beats so you can create background music. And these are things that happen in the world that one young person does and is available for us all the time. So this is our address. You can reach us in Abuja, by email, by telephone, by WhatsApp, and of course you can visit our website. So thank you very much for your time. We can now have questions and answers, and then we'll do a demo if time permits. Yeah, we will do a demo if time permits to showcase what it is. So right, questions and answer session. I'm done. Any question? Any question from the audience? Are we there? Hello? Am I talking to myself? Nkesi?
We are with you, sir. Good evening.
Hello, sir.
Hey, Njoku,
No, we are hearing.
Okay, any question?
Yeah, I have a question, please.
Go ahead.
Okay. I don't want to compare, but I want to see a situation whereby the platform can develop a USSD that will have all those options that people can select from. It makes it easier for us to access it directly than, typing the website, logging in, then start looking for all those packages that it provides. Yeah. So when you have the USSD, it gives you a direct access. You just type in the code, and then it lists out all those packages, and one can access them directly. Thank you.
Okay, so thank you, Chison. I agree with you completely. What we're using now is a portal. We've also worked on the app. And of course, you may not know, or maybe you even know, but each time you deploy any platform, there is a cost at the back end of it. You cannot just say, oh, you are deploying an app. We've been working on the app for a while. We finished the whole design. We even have approval of Floaterway. In fact, Floaterway have tested it and has given certain approvals. The same thing with USSD. So when you are developing a system like this, it is in phases. Even the social media platform we are seeing, Facebook was only like those days. If you go to Facebook, the only thing you see is like. But now on Facebook, you can do, you can see most options for you to say, oh, I like, I love, I smile, and all things like that. So we have a blueprint, and we're working stage by stage, and managing the back-end costs. Most of these things are not free. The licenses are not free. So we're managing the back-end costs so that we don't find ourselves in a situation where, oh, we cannot manage the cost that is involved. So that is why we're taking stage by stage. And it's important for us now to make sure that people use the platform. So it's like any other digital system you are developing. If you don't give people opportunity to use it, and you're waiting for all the components to be there, you pile up a lot of licenses and they will not make use of those licenses. But thank you very much for the question. Does that answer you? Any other question?
It's clear. Thank you very much.
Okay, so can you send us your phone number and network so that we can give you airtime?
Is there Is it on the chat section, sir?
Okay, which network? No, I've seen, okay, Chison Joku. Okay, this MTN, right? Okay, fine. I've seen your number. It's MTN, right?
Yes, it is.
Okay, it's fine. So when we now start the demo, you will see a type from our system. You will see practically how it's done. Any other question? Okay, so if there's none, the guest speaker can talk now, and then we'll do a demo and round up.
Thank you very much, Doctor. Hello?
Go ahead.
Yes, I think it's actually not a question, but just to a follow-up from my promise last on Sunday.
Yeah.
So today, about 5 people from Calabar joined the meeting.
Okay.
So I'm working very hard to bring them in more.
Beautiful. Thank you very much. Thank you very much. Our job, as I said, we are broadcasters. We're only here to provide education and information for as long as our time permits. And as we bring in people to listen to us, it is their decision. But of course, even as lecturers in the university, you teach people certain topics in their career life. It's up to them to make use of it or otherwise. So thank you very much.
You're welcome, sir.
So is our guest speaker here? If he's not here yet, we can now start the demo. Okay.
I'm here.
So Garba here, give us your remarks, and then I'll do the demo.
Okay.
You want me to do the demo first? You want me to do the demo first?
Okay, so let me hold on.
Okay, fine. Let me do the demo first so that people will see how this works. Where is my internet? Okay. So this is the portal. It's a very simple portal. It's not heavy and it deliberates. So it goes on to, this is the portal. What I've described to you, these are the options that we showcase for each of these. You get this. So if you have a shop that is 50,000, you get this. If you have a shop that is 100,000, every week you get 1,000. And use that 1,000 to buy your airtime. At the end of 1 year, your 100,000 is that for you. If your shop is 1 million, again you get 10,000 every week. So the idea is that if we're expending around 600,000 per year, you get a shop that is 1 million, so that in 52 weeks you have 520,000. You use that money to service all those things that concerns you, and then the 1 million is still intact. On the day that the system expires, your trading period of 12 months expire, they will call you. Somebody, a support team will call you and tell you that your shop has expired. Do you want to withdraw your money or otherwise? You don't, in fact, that is just a reminder. Otherwise, you can stay at home, withdraw the money, and nobody cares because the system is automated, it's encrypted, it's working automatically. You don't need anybody. It's you and you yourself alone. You can withdraw that money. If you decide to roll it over, beautiful. Because by then, you would have gotten a lot of funds on it and stuff like that. So I'm going to sign up in now, and then I'm going to sign up on the shop we use for this project. So it's 10/24/80. So this is the password. Dr. Obaji. Hello?
Yes, Doc.
Okay, so have you noticed this shop is trading at 1 million? Now we created this shop as part of this project. Now have you noticed the increase in commission every week?
Yes.
Have you seen this?
Yes.
Last week it was 30 something, and of course it keeps increasing, right?
Yes.
So the essence of this stuff is that when we started this project, we know that we will need money to buy Zoom time. We need money to even travel. So instead of keeping 1 million in the account, we say that, okay, when somebody wants us to travel and do this, no, we carry the 1 million. The 1 million will now be trading on a weekly basis and giving us commission here. You have seen commission of 51,000. This money can be withdrawn to the bank. Now, if our staff now wants somebody say, okay, fine, send your staff to come and do this for us, we will simply withdraw this money and give them to take their next available vehicle to your location at no other hurdle to us. No issues. Now, if you look at this, if you come under wallet transaction, you look at fund history. It will tell you how this shop was created. Now, look at it. On the 29th of March, we now had 25,000 naira and we created this shop. Now, suddenly we did a project and had some money coming. We now say, okay, fine, we are going to upgrade this shop. So on the 6th of April, we move in 475,000 to make it 500,000 and move another money to make it 975 plus this 1 million and upgraded the shop to 1 million. So this shop has been trading since April 6th. And that is what we are seeing the funds here. Now, if you look at this, at the end of this fund, you have 97 naira here. I'm going to back airtime for you of 500. Now, once I'm done, 10% of that commission will equally come here. That is what 2% rather. So each time you back airtime in the bank, 2% commission is charged on the amount of money you get, and the bank gets that as commission. So we're going to demonstrate that here. And of course, I keep saying that this system is automated, and anywhere you are, we can actually deploy, and your system will be serviced centrally. So I'm going to buy airtime. The airtime is Chison's airtime number, and I'm putting 500 here. So this is it. I'm picking from this. You have 1,025 naira. So I'm going to pick 500 from here and then say pay. Good. Now that it's paid, within 30 seconds, Chison would have seen a lot on his phone that 500 naira has been paid. Is now on his phone as airtime. Now I look at the virtual wallet here, 500 have been deducted. Now 2% of 500 is 10 naira. 10 naira has been added to 97, making it 107. So this is how this system has been designed. This is how it's working. Now, if I said we are doing zero overhead cost, what it means is that as much as I spend on this project for 6 months, and then we get to Portal to present, when the final day, which is March 9th, comes, this 100,000 will back to us. I would have used the commission to service ourselves. So on that note, I want to thank you very much. I will now allow the special guest to have the final word and will close. Meanwhile, if you have seen the airtime, let us know. Dr. Chison, if you have seen the airtime, just chat, send us a chat.
Yes, I have. Yes, I have. Thank you very much.
You have seen the airtime already?
Yes, thank you, sir.
Okay, thank you very much. So the special guest is here to round up so that we can now leave.
Okay, thank you so much. Good evening once again, Dr. Kenny and colleagues. I want to really commend you for your tenacity to ensure that this project survives. It's not easy, there is what is called this behavior change. You have to make a lot of contact before you convince somebody to at least be part of something that he or she is going to benefit from. But however, sometimes the individual making the contact will make the choice easier or difficult. For instance, you are a friend, and when you contacted me in Taraba and you told me this concept, I couldn't hesitate to join. And I started, and now I'm really seeing the benefit. What I'm trying to do now is I have a foundation with over almost 20 staff. So that combo pack we're talking about, I'm trying to see how we can now use it. We have a project we're about to commence any moment from now, and we're going to use community case workers in about 6-7 LGS. So those community case workers are going to be at least not less than maybe 30 also in the communities. So if we put all these numbers, I think that combo pack is going to save a lot of money for us. So this is something I want to discuss subsequently.
Okay.
Furthermore, I want to say this, I've seen this benefit both directly and indirectly. For instance, I have a daughter that is in a higher institution. I opened an account for her. of 250,000. So when she's broke, she just go to the commission wallet and use it. So, and that thing have really relieved a lot of stress on me. So I'll just say, okay, how much do we have now? So I have this, that. They will say, please use it. And sometimes you call me, I may not have the money immediately, but that one has been helping a lot to pushing some of this. So I think this is something I will encourage all of us to really buy in. It's really helpful. I've seen the benefits. I've reached my ceiling of 1 million because of his own encouragement. I deactivated it last week, and I don't have any intention of removing that money from that account, because that 1 million could have gone to another place. But I've been seeing the dividend of that 1 million. And of course, I'm seeing the benefit, creating an account for my daughter, which in case of emergencies, she can just go there and then handle some of her immediate school issues. So I want to thank Dr. Kenny and the team for this wonderful project. In Taraba, I will do my best. I can see Dr. Soni is also here with me. Dr. Obanus has joined, but he's out of the call. So I'll try to see how we can mobilize as many of our colleagues as possible to benefit from this important package. So I want to thank you once again, and I wish you a successful project. Good evening.
Thank you very much, Dr. Garba. You know, you are a chief in Taraba. What surprised me was at that time we were building and people didn't even want to listen to us. But that is what technology is all about. When you start, you keep improving on it. And where we are now, boom, we reach a point where we keep building on the system. We are building a community where people have income from airtime trading and can use it for almost everything. We are expanding that community. Our goal this year is to reach 10,000 members. And of course, the final destination is when we have 1 million subscribers. So we're building every day. Thank you very much for your contribution. Thank you very much for spending your time to be on this call. Have a wonderful time. Thanks everyone for being here. Thanks for joining to listen to us. May God bless everybody. We look forward to all of us implementing this project and giving us the feedback that we need. Don't be afraid of anything you discover. Let us have the feedback, and then we can build on that feedback and have something solid. So have a wonderful time. If you have other comments, you can let us know. The link is behind, is in the chat box. If you want to sign up now, you can go ahead and sign up. If you have signed up already, no issues around that. Just ensure that you keep on learning and understanding the system that works. In November, we're going to have a survey, and we want you to have give feedback that is concrete for us to push the system forward. Thank you very much. Have a wonderful night.
Thank you. Good night, everybody.
Good night. Thank you very much for getting people to listen to us.
Good night, Dr. Kene. Bye.
Thank you very much. You too. Thank you. Good night, everybody.